Well, perhaps the angst around this subject is our collective lack of understanding, so that's why this first panel is so important. Each of us may grasp parts of the issue, but probably not comprehensively. To lay the foundation of an understanding, we'll begin by defining Social Security and looking back at its beginnings. And to help us do that, we are joined by Alice Hoffman, a retired professor of labor history from the Department of Labor Studies at the Pennsylvania State University. She was also the director of the Department of Dislocated Workers at Pennsylvania State Department of Labor and Industry. She's currently on the board of the Pennsylvania Alliance for Retired Workers. Welcome. Also on our panel, now this is a change-up from the original program, AARP's Christina Martin Furvita was called to a super committee meeting, ironically, today. Stepping in her place, we're happy to be joined by Thomas Nichols, a senior legislative representative for AARP's Government Affairs Department. He is the lead lobbyist and policy expert on Social Security and pension matters. Before we get started, I just want to remind you to our audience here at Arched Hall, there is a question and answer segment after each of our panel discussions, so write your question down and someone will be by shortly to pick it up. For those of you that are joining us on our webcast, you can email your questions to the email address that Tom mentioned. So let's begin, and we begin with Tom Nichols. Let's start by the confusion. How confused do you think the public is about this issue?
Well, I think that's a good question. Certainly, with AARP, we obviously have a lot of outreach that we do towards our members, both from an education perspective, but also mostly from an education perspective, to obviously talk to them about what the issues are currently and to keep them informed on what's going on. We certainly do a lot of teletown halls throughout the country, and we tend to get very similar questions on those teletown halls that do tend to show some people not necessarily understanding how the program works. Particularly in terms of the earned benefits, how long it takes to actually qualify for Social Security, certainly about how the trust funds operate is obviously another large area of uncertainty. I think that you can also even get into some very highly technical and very highly personal questions too about when you can claim for Social Security, if you have eligibility for benefits like survivor benefits or dependent benefits, again, retirement, disability. There's any number of nooks and crannies of Social Security that I'm sure that people would be well served to be better informed on.
So let's get started with some definitions. Alice Hoffman, define Social Security. Is it a trust fund? Is it an insurance program? Is it an intergenerational compact? Is it a combo? What's your definition?
It's all of those things, and was originally designed to be all of those things. As far as it's being an intergenerational compact, I can tell you that I have been in a number of forums like this in which young people are confused, and that there were various politicians speaking to the seniors in the audience and saying, well, we're never going to touch your Social Security, have no fear. This is something that will affect other generations. I was inclined to say to our Congressman, this audience of seniors is deeply insulted by such an answer. To think that we are only concerned to get ours and not concerned about our grandchildren and children. I can tell you that when Medicare was passed, which my father had a great deal to do with writing the bill, in August of that year of 1965, he sent me a memo and said he just wanted me to know that at the time in 1994, after June 17th of that year, if I had to go to the hospital, I could tell his grandchildren and my grandchildren that at least a major portion of my hospital bills would be paid. So you see, just as the bill was passed, its initiators who began the program were thinking about the next generations as well.
It also has to be something that's somewhat fluid, I guess, and history proves that. Tom Nichols, how is it different today than when it was originally envisioned?
Well, as far as obviously in 1935, it started out as a retirement program. but very, very shortly after that. And by a retirement program, again, I would have to go back to the idea that it is social insurance. So it's basically an insurance program that allows you to prevent the loss of a significant portion of your income, or a portion of your income, due to retirement or disability or the loss of a primary breadwinner. So I think that obviously it did start out as a retirement program. Very shortly after that, actually within about 4 years, it then moved to providing benefits for eligible dependents, women and children. In the 1950s to the early 1960s, it was expanded for disability insurance. And there have been minor tweaks to the program beyond 1960. However, the three main components by 1960 were then in place, which is that there's a retirement, a disability, and a survivor's component of Social Security.
So Alice, what are those changes, those modifications on the timeline? Tell us about the program, and especially, hearkening back to your father's role in some of the modifications to Social Security.
Well, I think they saw it as social insurance, and the bill had originally included national health care. But Franklin Roosevelt decided that that was maybe a journey too far, and they would put that off for the time being. Well, we still don't have national health care. What they got was Medicare, which covers just mostly senior citizens, unless it's Medicaid, which would cover a larger portion of the population. But it was always seen as an insurance program, which would have the famous three-legged stool. It would have three components. It would have the government insurance program, paid for in part by the funds that everyone has taken out of their paycheck during their working life. It would also have pensions that might be achieved by collective bargaining or the company for which you worked, and also an opportunity to add to it your own careful savings over a lifetime.
Very quickly, Tom, before we get to some questions from the people who are here, the reality is we live longer and we work longer. So how is that having an impact on the program?
Well, I think that's a good question. Certainly for being on the program for a longer period of time, it does have an impact on the overall value of the trust fund. I think the issue is, though, when you do start to talk about changes to the program based on longevity, we do have to realize that there are, I'm very fortunate. The vast majority of time that I spend working, I spend sitting down working or in a cab on my way to the Hill. There are a lot of folks out there who, whether they be in manual labor, construction, housing, nurses, anybody that stands for a very long time, it's very difficult. At the very least, we have to understand that, yes, longevity is certainly an issue, but so is the idea that some people can't necessarily work, and we can't necessarily continue to extend the full retirement age beyond a significant period. I mean, obviously, full retirement age is actually going up as we speak. So it's moving up towards 67 right now. To push that even further, there are components that we have to think about in order to make sure that we make smart decisions.
Well, let's go to the questions from our audience. Those that are here, you've written your questions down. For those of you online, please send us your questions via email, especially as the afternoon continues here. I want to remind you that we're receiving our answers from this panel, which includes Alice Hoffman, who's a member of the board of the Pennsylvania Alliance for Retired Workers, and Tom Nichols, who is the senior legislative representative for AARP's Government Affairs Department. So let's get to the first question. In your opinion, which reform in the past made the most substantial changes to Social Security as we know it? Alice, why don't you field that first?
Well, there's no question but what it's Medicare and Medicaid that made the most substantial change. I think that it's important to keep separate Social Security from Medicare, because Social Security is in no danger of making its payments. It's safe from the trust fund till the year 2035 at least. In 76 years, it's never failed to make an appropriate payment. But Medicare is another story. There may be some more significant changes that we'll have to think about with respect to Medicare, because the expenses of medical care have gone way up. So I think that we need to be very careful when we're listening to the radio or to the media to lump the two together because they have quite different problems.
Tom, let's expand our horizon for a moment. How does Social Security compare to similar programs in other countries?
Well, I think that an argument can be made that other countries probably expend more resources on probably more universal systems. Although, again, with Social Security, it's basically almost near universal coverage. It's about 94% of the American working population contributes to Social Security. About the 6% that doesn't tends to be in a state or a local government employee type of a situation. I think that, again, we all have to ask ourselves, and we have to ask ourselves individually and also as a country, you know, what type of society do we want? And how much do we want to spend on what we want, frankly? And that obviously is a lot of the question that's going on in Washington right now. What I know, going back to a former boss of mine who was a member of Congress for a very long time, he remembered a point in time in our history when we had things like poor farms and almshouses. And this is before the advent of Social Security. So I think that we decide as a society that we want to make sure that our seniors and the disabled and those who are surviving dependents, that they're able to live their life with their retirement years, whatever it may be, with dignity. And I think that we agreed to that as a society, and then we have to understand that comes also at having to pay for it as well.
Alice wanted to add something, and then we'll have time for one last question.
Right. I have written quite a bit about the founders of Social Security and what their aims and goals were. And one of whom was my father, who played a significant role in writing the Medicare bill. One of the things that he said that I would like for everyone to keep in mind, he said any social program over time will need to be modified and changed to meet new circumstances. But he said, let it be done by those people who are its friends, and not torn up by the people who have not liked it from the very beginning.
That leads us to this question from our audience, and it refers to debates in the media in southern Delaware. Some media hosts in southern Delaware claim that Social Security is obviously unconstitutional. Has it ever been tested in the courts, Tom, or whichever?
Yes, it has.
Yeah.
It has. Supreme Court Justice Cardozo said in 1937, when it came before the court, he said, the Constitution does provide that we can make changes for the common good.
You have anything you would like to add to that?
I think that was a well-answered question.
All right, we have time for one final question, and that is, and I would assume that this is a question that really should go to Alice. What lessons from history can we apply to today's debate over Social Security? Perhaps some of them at the kitchen table in the house where you grew up, but what are the lessons that we can pull from history?
Well, I think very much what I said is that we do need to think about changes in it. And one of the things that I think, when you think that this is a program from the Depression, and there was a lot of unemployment, whatever problems we have with both Social Security and Medicare would go a long way to going away if we had full employment at good jobs. That's where I think we need to put our effort.
Final word?
Final word is that I think that when you look back at our society around 1935, is that we had a 50% poverty rate for seniors. And with Social Security, one of its major successes has been that right now that poverty rate is under 10%. It's a hugely important program. You almost can't overstate how important it's been, both to current generations, but also to the millions upon millions of people that have received Social Security already, and to future generations. It's an incredibly important program.
On behalf of everyone here today, I want to thank you, Tom, for filling in, but doing so with such style and some great information. Thank you so much. So to Tom Nichols and to Alice Hoffman, our thanks for bringing your thoughts to help us build the foundation so that we can continue this conversation and hopefully look toward the future.